হাড়ের সমস্যা দেখা দিচ্ছে ছোট বাচ্চাদেরও, এমনকি সদ্যজাতের, এমনকি জন্মের আগেও। চেন্নাই অ্যাপোলো প্রেজেন্স ডাক্তারবাবু কি বলছেন? अभी तो छोटा है, ठीक हो जाएगा.
Sometimes when the child starts walking with a limp all along, that means there is a major problem. Nowadays the main problem is rickets.
Ultrasound report said that the baby has the club foot.
Just to treat it with a plaster cast followed by a shoe. If they come at the age of 6 months or 1 year, then you may end up doing multiple surgeries.
Lock knees, disformation of leg, duck walking like that.
Always the child is born with a bow leg. If it is symmetrical, we are not worried.
They have to carry very heavy school bag, online classes and screen time.
Not helping the child to have a normal life. It's not only heavy weight in the school bag, the way they carry.
Back pain and knee pain at very this early age.
You cannot sit for more than half an hour. You have to get up and move around for some time and come.
আমরা ভাবি হাড়ের সমস্যা বুঝি বয়স বাড়ার সঙ্গে সঙ্গে বাড়ে, কিন্তু এখন বাস্তব বলছে অন্য কথা। হাড়ের সমস্যা দেখা দিচ্ছে ছোট বাচ্চাদেরও, এমনকি সদ্যজাতের, এমনকি জন্মের আগেও। এছাড়া 20-25 বছরের কোটা থেকে কোমরে ব্যথা, হাঁটু ব্যথা, নানা রকম সমস্যা তো আছেই। এসব কি স্বাভাবিক, নাকি আমাদের শরীর কোনো ইঙ্গিত দিচ্ছে যা আমাদের দেরি না করে শোনা উচিত? দ্য ওয়ার্ল্ড আরোগ্যর আজকের নতুন এপিসোডে আমি তিয়াস, চেন্নাই অ্যাপোলো প্রেজেন্স ডাক্তারবাবু কি বলছেন, এবং এই উত্তরগুলো পাওয়ার জন্য আজ আমার সঙ্গে রয়েছেন অ্যাপোলো চিলড্রেন্স হসপিটাল চেন্নাইয়ের সিনিয়র কনসালটেন্ট পেডিয়াট্রিক অর্থোপেডিক অ্যান্ড স্পাইন সার্জন ডক্টর আর Shankar. Welcome, doctor.
Welcome.
Welcome to the World Arogya. Doctor, when we find any problem in children, like they are walking differently, they're like limping, or any problem is seen, sometimes we think that it will be gone with the time. अभी तो छोटा है, ठीक हो जाएगा. What are the red flags that one parent shouldn't ignore?
See, the thing is, once the child starts walking at the age of 1 year, it will take at least for a year or two for a child to walk normally. During this period, child will have a problem of limping. It can be because of a fall. Child can hurt her leg, then start limping. That limp will settle within 3 days or a week. But sometimes when the child starts walking with a limp all along, that means there is a major problem.
Okay.
So it's always better to consult an orthopedic surgeon to find out what the problem is. The limp can be associated with pain or without pain. Pain may be because of an injury or an infection. Urgent treatment needed. Without pain, it's a chronic problem. You have to consult a doctor, but waiting for a week or two is not going to be a problem.
Right.
So whatever happens, always better to get an opinion from the orthopedic surgeon.
Right. We have to monitor the time, and then we have to find the cause.
Yes.
What is doing
Yes.
that way.
So doctor examines and he has to do tests to make sure there is no bone injury or no infection. Sometimes dislocated hip in a child will also produce short leg. Child will start walking with a limp. Nowadays the main problem is rickets, vitamin D deficiency. Child is perfectly normal, but gradually the walking starts walking like a duck, waddling gait. So you have to be very careful. When this happens, there is a problem. Always consult a doctor.
Doctor, even a child is born. Before that, sometimes ultrasound reports said that the baby has the club foot, and the parents get very upset and they think it would be like how the baby will born and how he can do anything. Can we cure club foot right now, or is it a big problem?
Yes, we can. The child can be born with one foot problem or both feet problem. So club foot is a common bone birth defect we see for a long time. But nowadays we have a treatment that is just to treat it with a plaster cast followed by a shoe. For about 2 years. We can get the feet corrected almost like a normal feet.
Okay, no surgery needed.
Very rarely we do like a cutting the heel cord. That also is like a daycare surgery. But after that, the child has to wear the shoes only at night.
Okay, so club foot is not now that big problem that the baby will not like properly any time.
The thing is, club foot is visible as soon as the child is born.
Okay.
So if you start the treatment early, The feet is very supple, easier to manipulate and put a plaster. Whereas if they come at the age of 6 months or 1 year, then you may end up doing multiple surgeries.
Okay.
So early treatment will come with the best outcome.
Early treatment is the best treatment, right? So not only clubfoot, sometimes parents complain like for lock knees or any disformation of legs, or child is having problem in running, duck walking, like that. These many kind of typical small problems, are they really small or they have to be treated like very seriously?
No, if the child starts walking, the child's leg can be straight or pointing outwards, like we call it knock knees, the knee hitting against each other, knock knees, or a bow leg. This, when the child is born, always the child is born with a bow leg. As the child grows, by 1.5 to 2 years, it becomes like a knock knee. And by the age of 7 years, it becomes almost like a straight leg.
Okay.
So, as long as it is not getting worse, if it is symmetrical, we are not worried.
Okay.
But if it is progressive, or it is getting worse, or only one leg is involved, we are worried. So the commonest cause of limping nowadays, or duck walking you were talking about, is a condition called rickets. So the child is not exposed to sunlight, not having adequate calcium, develop a condition called rickets. The bone becomes soft. When the child starts walking, then the bow legs gets worse.
Right.
So early diagnosis and early treatment, this disease is completely reversible.
Okay. Like it's like treatment delayed is treatment denied kind of thing.
Exactly.
So nowadays, children when they go to school like that, they have to carry very heavy school bags, and some spine problems are there. And also nowadays, online classes and screen time is like very common for every children. You can't avoid the screen time, or you can't avoid the sitting posture or anything. What are these causes? What are the scenarios that the children's spines, they become very weak or whatever?
So for a child to be healthy, you have to go out in the open, run and play every day. That only keeps the bone and the body healthy. Nowadays, children sitting at home, watching the TVs, playing with the phone and doing online classes, this is not helping the child to have a normal life. So when you are like that, again, like a school bag issue, when you are carrying a heavy load, invariably child will start getting back problem. It's not only heavy weight in the school bag, the way they carry in one shoulder, they carry in both shoulder, but hanging up to the knees.
Yes.
There is a way to carry a bag. And always the weight of the bag has to be 15% of the child's body weight.
Yeah,
that is what the government recommends.
Okay.
So if the child is only 10 kilo, they can carry only 1.5 kilo to 2 kilo weight. More than that is not allowed. So they have to control. For today, only you can take this many books and notes to the school based on the timetable. And again, when you are sitting and watching a TV or school, you have to sit straight back with the hips and knees bent 90 degrees. This is the ideal position. Like sitting like a crouched position will cause back problem at an early age.
Okay, that's very important point for our parents. They need to remember it and apply to the children.
That's right.
Right. So, is there any tips that from childhood how they can get a healthy bone up to their old age?
So we talk about drinking plenty of milk. So for a bone to be healthy, there are 3 important things. You have to have a plenty of calcium. Calcium is available in milk and green vegetables. So you have to find out what fruit, vegetables have plenty of calcium. You have to give that kind of a thing. But whatever amount of calcium you eat, it is not being absorbed from the gut. So for that, you need vitamin D. Vitamin D is available only in the sunlight.
Okay.
So child has to go out and play in the sun.
Right.
And vitamin D and calcium is not enough. You have to have adequate exercise.
Okay.
So child has to run and play for at least 60 minutes every day for the bone to be healthy. So you need vitamin D, you need calcium, you need adequate exercise. If you can do all these 3 things together, child will have a healthy bone especially when they become older in women, they will not develop osteoporosis at an early age.
So when the child grows up, like when we reach to 20 or 25 or 30, like that age, it's also early age, right? It's not the age for like weak spine or anything, but still we are complaining of back pain and knee pain and whatnot at very this early age. What are the difference? What are the causes?
That is a lifestyle. Okay, so for it's not only for a child, even early adults, you have to have a regular exercise. Unless you do regular exercise, your body will start wearing out early. Again, when you are sitting and working in an office, you cannot sit for more than half an hour. You have to get up and move around for some time and come. So sitting for a long time, sitting in the wrong posture, all this will lead to back problem. Knee pain and hip pain, all the joint pain, again the same thing. You have to keep moving the joints, otherwise they'll have problem later at a later stage.
Okay. About the exercise, what happened that when doctor recommends exercise, one fine morning person gets up and go to gym and do very heavy things and all. Also for children, कि डॉक्टर ने बोला है जाओ भागो बहुत भागा, तो फिर स्पोर्ट्स इंजरी आ जाता है कभी कभी. तो स्पोर्ट्स इंजरी के कितना केसेस अभी आता है आपके पास और ये कैसे होता है? सबसे कॉमन स्पोर्ट्स इंजरी क्या होता है और उससे क्या करना पड़ता है?
We see plenty of children with sports injuries. Children playing football and hockey develop knee injury. Children playing basketball develop ankle injury. Racket sports like a badminton, tennis, they develop shoulder injuries. But as long as you warm up adequately, loosen your muscles, you have to go and play with as much safety as possible.
Okay.
But there are some sports like skating, cycling, horse riding. We advise all these children to wear a protective gear.
Okay.
Helmet, knee support, elbow guard. This will prevent or restrict major injuries. So you have to take adequate safety and wherever there is a protective gear available, to wear those things to have a safe sports.
So when injury is very high or for any reason, we can also hear that the word surgery. You have to do the surgery and all. Or surgery सुन के ही हमें लगता है, we get very fear that the bone surgery, it would be very like how it would be happen. Nowadays, surgeries are going easier than previous one.
No, actually the way you look at it is, child's bone is a growing bone. If you have a problem, you go to a general physician. Whereas your child has a problem, you go to a pediatrician. The same thing in orthopedics. If an adult has an orthopedic problem, they go to an adult orthopedic surgeon. Child goes to a pediatric orthopedic surgeon like me. Why? Because the bone in a child is a growing bone. Pediatric orthopedic surgeon understands how the bone grows and treats accordingly. We do very less surgeries in a child, whether it's a fracture or even if there is an infection. But there are latest advances nowadays. We can talk about so many things. Best anesthetic care, best ICU. And you have about 20-30 years back, there is nothing called a children's hospital.
Right.
Now we have a children's hospital where all kind of specialties available. So child comes with a problem, we all look at the child as a whole and treat without any problem.
Okay.
Again, advances in the surgical technique, equipments available, robotic surgeries, there are so many advances. So the surgery is almost as safe as you can think of.
Okay. So for robotic surgery, how the outcome goes very well? How does it come?
Robotic surgery is more common in adult, like a knee replacement, spine surgeries. But the thing is, because the robot helps us exactly where to put a screw or a plate, where to cut the bone in an adult.
Right.
So the pain is minimal, recovery is quicker. Okay, but still the surgery is done by a surgeon, but a robotic helps the surgeon to prevent any complications.
Right. So if you have to give any 3 or 4 tips for the parents to protect their children, what it would be?
No, give healthy food. Don't allow the child to sit in front of the TV for too long. Allow the child to go out and play every day. Education is not the only one which is going to make the child do well. Child's health also is important. Only if the child is healthy, the child can do well when the child becomes a big man or a woman at a later stage.
আমাদের শরীর, স্পেসিফিক্যালি শরীরের হাড় কখনোই হঠাৎ করে জবাব দেয় না। খুব ছোট ছোট বিষয়, আমাদের বসার ভঙ্গি, আমাদের হাঁটা, আমাদের চলা, আমাদের কতটা ভারী ব্যাগ ক্যারি করছি, এই সব কিছুই ফ্যাক্টর হয়ে দাঁড়ায়, এবং সেটা খুব ছোট বয়স থেকে, একদম জন্মানোর পর থেকেই। ফলে বিশেষ করে মা বাবাদের বলছি, আজকে ডক্টর শঙ্কর যেরকম সুন্দর করে বুঝিয়ে দিলেন, সেরকমভাবেই ছোট বাচ্চাদের লক্ষ্য রাখুন এবং যে কথাগুলো বললেন সেগুলো মাথায় রাখুন, তবেই না একটা সুস্থ ভবিষ্যৎ পাবে আমাদের সন্তানরা। এই সংক্রান্ত কোনো বিষয় জানতে, ডক্টরের অ্যাপয়েন্টমেন্ট পেতে বা কোনো তথ্যের দরকার হলে স্ক্রিনে দেওয়া নাম্বারে যোগাযোগ করুন, কল করে বা হোয়াটসঅ্যাপ করে। ততক্ষণ দেখতে থাকুন দ্য ওয়াল, কারণ খবর এখন এখানেই।